Yeah, this is even now some hypersensitive detection number third. So discussed and I have done exams in previous topics. So we go through so hypersensitive detection is an appropriate or over the active immune responses to antigen, resulting in undesirable effects. The symptoms typically appear in an individual who had at least one previous exposure to the antigens or any form of particles. So hypersensitivity reactions can be classified into four types. As I discussed, like hypersensitivity reaction number one, two, three, and four. Today I'm going to teach you the hypersensitivity reaction number third. So in this topic or in this video, hypersensitivity reaction is an abnormal immune responses. It is mediated by the formation of it's called the immune complexes. They can precipitate in various tissues such as skin, joint, vessels, and glomeruli of the kidney, trigger the classical complement pathway. Complement activation lead to the recruitment of inflammatory cells. Those cells are monocyte, neutrophils, and these cells release the lysosomal enzymes and free radicals at the site of immune complexes causing the tissue damage. So the most common disease involving a type third hypersensitivity reaction is a serum sickness and post streptococcal glomerulonephritis syndrome, systematic lupus erythematosus, farmers lungs that are also called hypersensitive pneumonitis, and the rheumatoid arthritis. It is a very common in old age persons these days. Principal feature that separates the hypersensitivity reaction number third from other hypersensitivity reaction in that in type of third reaction the antigen antibody complexes are preformed in the circulation before their deposition in tissues. So the etiology is the serum sickness is caused by the drug containing protein moieties of other species like heterologous protein such as antivenins, vaccines, antitoxins, streptokinase, a type of the enzyme. And the heterologous protein can act as an antigen triggering the immune responses in the body. So monoclonal and polyclonal antibodies prepared from the rabbit mouse serum like anti-thiomycin globulin OKT3 and have been found to cause the many types and the cause the hypersensitivity reaction number third. So the serum sickness like can be seen with the synthesis monoclonal antibodies and used in the management of rheumatoid arthritis and Crohn's disease. So we also used to treat the asthma also known to the associated SSLR that is called the severe sickness like reactions. So infectious diseases like hepatitis B, bacterial endocarditis presented continuous sources of antigen to form a circulating immune responses. So the pathophysiology of these reactions, like after exposure to the antigens or any foreign particles, the individual immune response respond by creating antibody after 4 to 10 days. So the antibody react with the antigen forming immune complexes that circulate and can diffuse into the vascular walls where they may initiate fixation and activation of the complement systems. So these immune complexes along with complement produce the influx of the polymorphonuclear lymphocyte into the site where tissue damage takes place by release of the proteolytic and proteolytic enzymes. That process takes place in three steps: immune complex formation, immune complex and deposition, and inflammatory reactions. So first is the immune complex formation. So endogenous and exogenous antigen exposure triggers an antibody formation, and the exogenous antigens are foreign proteins such as infectious marker or a pharmaceuticals product. So endogenous antigens are self antigens against which the autoantibodies are generated. That is also called autoimmunity. So immune complex deposition, the pathogenicity of immune complexes is partially dependent on the antibody ratio. So the third is the inflammatory reactions. So after the deposition of the immune complexes, the final step is the activation of the classical pathway leading to the release of the C3A or C5A, which then recruit macrophage and neutrophil that cause inflammatory damage to the tissues. Depending on the site, symptoms of vasculitis, that is also called blood vessels, arthritis in the joints, or glomerulonephritis in the glomeruli of the kidney develop. So if I talk about the complications, so there are various complications related to the hypersensitivity. That's number third. So like serum sickness, that's also called vasculitis, acute kidney injuries, glomerulonephritis, it is the inflammation of nephrons of kidney, hypersensitivity pneumonitis, alveolitis, pulmonary fibrosis, and core pulmonary, and the hypertension, infections, thrombosis, glomerulonephritis, and stage renal diseases, and miscarriage. So acute kidney injury and requiring the dialysis, chronic disease, kidney disease, proteinuria, and hypertension. So if I'll talk about the differential diagnosis, so hypersensitivity 1, 2 are antibody mediated reactions similar to the type 3. So their clinical features can develop. So type 1 immediate hypersensitivity is mediated by the performed IgE antibody that coats mast cells of body, and IgE antibodies are cross-linked to the free allergens or antigens, so leading to mast cell degranulation and release of the histamine and inflammatory mediators. Example of the hypersensitivity number 1 mediated conditions are anaphylaxis, bronchial asthma, allergic rhinitis, and food allergy. So basically, the treatment and managing role of the in the hypersensitivity reaction number third are like removal of the offending agent is the mainstay of treatment of type third hypersensitivity reactions as well. Antihistamines we can like give the patients, non-steroid and anti-inflammatory drug also we can dispense to the patient to provide the symptomatic relief as well. So corticosteroids are also used in the severe cases to suppress the inflammation reactions. So the avoidance of the exposure to allergen is critical to the management of HP, and corticoid steroids are helpful in the patient with the inflammatory features also. So the patient must be hospitalized in case of hemodynamic instability, life-threatening symptoms, or unclear diagnosis. So many infections or autoimmune diseases are linked to the type 3 hypersensitivity reactions. So a consultation with the dermatologist, immunologist, and infection disease specialist must be considered if I've seen even if I'm suffering from the type third hypersensitivity reaction. So treatment of the autoimmune disorders like SLE include one or a combination of hydrochloroquine. It is the NSAID type of drugs like erythropoietin, cyclophosphamide, methotrexate, and myclophenolate, and tacrolimus. There are the numerous drugs like we have made for the type 3 hypersensitivity reaction and to treat the patients as well. So if you are seeing any type of any patient with the type third, or if you are suffering also yourself, so you may visit frequently, promptly to the your nearby physician, and you may get also hospitalized because it is very life threatening, and there are so many type of the like organs may affect with the type of hypersensitivity reactions. So thank you so much. I hope you understood the topic. If you have any problem, let me know in next class. Thank you so much. See you in next